Right now on WRAL at 5:30, some new calls for better oversight of nursing homes in North Carolina.
A newly released audit reveals 39% of complaints that were investigated late. That's 4 out of 10. It also finds 68% of homes statewide were inspected late. Thanks for joining us. I'm Ashley Rowe.
And I'm Dan Haggerty. So problems in nursing homes. This is something that WRAL Investigates has looked into extensively. WRAL Capitol Bureau Chief Laura Leslie is live outside of the State Health Department after taking some questions straight to the leaders inside. And Laura, you also spoke with a woman who lives in one of those nursing homes who's sharing her concerns.
I did, Dan. You know, we've known for some time that short staffing is a problem here at DHHS. And, you know, that's a problem for a lot of businesses. But most businesses are not the last line of defense for our most vulnerable family members. So what we learned today is that the state is not doing enough to make sure nursing home residents are being cared for appropriately. We first told you about Barbara Pascal's problems with her nursing home in September. She says she's missed medications, been given the wrong medications, and been left to sit for hours in her own waste.
I complained in August, again in September, again in October and November. And I've given up trying to complain to the state because they don't care.
Pascal said she got a call from DHHS after our story aired, but no one has come to investigate. Do you feel like you've been abandoned?
Yes, I absolutely do.
A new state audit found that from 2021 to 2023, 4 out of 10 nursing home complaints, even serious ones like abuse or neglect, were not investigated within the 60-day window required by state law. Regular inspections were even worse. 2/3 of those were late. And the state didn't follow up as required by law 1/3 of the time. State Health Secretary Cody Kinsley did not dispute the findings, although he said COVID made the backlog worse. Kinsley said nearly 1 out of 4 positions at his agency is vacant. He said he's been asking for pay raises for years, but lawmakers have not agreed.
I want every complaint investigated ASAP. We can only do that with the necessary staff.
I asked him what he would say to Barbara Pascal.
It breaks my heart when we cannot respond as well as we want to. We fight so hard to get the resources necessary to do it, but in the end, that's never going to be a good answer for Barbara, and we're going to keep fighting until we can improve that.
A nursing home where Barbara Pascal lives is the Carver Rehabilitation Center in Durham. Has been the subject of many complaints from other residents and their families, as we've been reporting for you for months now. I contacted the company this afternoon for comment, but they have not yet gotten back to us. Laura Leslie, WRAL News, live in Raleigh.